Genetic and environmental causes are known for almost two-thirds of individuals with moderate to profound intellectual disability. A blessed day, everyone. I am Bobby Hart A. Duherte, and we are the Group 2. In this presentation, we will discuss about the prenatal, perinatal, and postnatal causes of mental retardation, also known as intellectual disability, as well as the cultural familial retardation. First, let us discuss the prenatal. Prenatal are those causes that occur or exist before birth or related to pregnancy. This consists of four risk factors, namely biomedical, social, behavioral, and educational. The first factor is biomedical. Under this is number 1, chromosomal disorders. In fact, there are 4 chromosomal disorders, namely Down syndrome or trisomy 21, Fragile X syndrome, Klinefelter syndrome, and triple X syndrome. Second is single gene disorders. Some of the more common single gene disorders are cystic fibrosis and hemochromatosis. Third is syndromes. The most common severe congenital disorders are heart defects, neural tube defects, and Down syndrome. Fourth is metabolic disorder. One example of this is the phenylketonuria or PKU. It is a deficiency of the enzyme PAH, results in high level of phenylalanine in the blood. Intellectual disability is the result if the condition is not recognized. Fifth is cerebral dysgenesis. Cerebral dysgenesis is the abnormal development of the brain while the baby is still in the womb. Sixth is maternal illness. This increases the chance that a baby will be born with a birth defect or a chronic health problem. Lastly, parental age. They noted that increased age of mothers is risk factor for fetal chromosomal aberrations, increased chromosomal number copy variations, and congenital malformation. Now let's proceed to the second factor, the social factor. Under this is number 1, poverty. It is found to be a powerful determinant of delayed cognitive development. Second is maternal malnutrition. Maternal malnutrition increases the risk of poor pregnancy outcomes, including obstructed labor, low birth weight babies, and postpartum hemorrhage. Third is domestic violence. Aside from it increases the risk of miscarriage and premature birth, it can also cause emotional and mental health problems which can affect to the development of the baby. Last is lack of prenatal care. The deprivation of prenatal care can lead to premature pregnancy, intrauterine growth retardation, low birth weight, and maternal and child mortality as a result of infections in perinatal and postnatal periods.
Hello everyone, I am Marlon Cariao and I will be discussing the risk factors during behavioral and educational period. And this includes behavioral. We have parental drug use. So parental drug use, research shows that drugs used during pregnancy is linked to health concerns, including high use of other substances that may impact pregnancy and infant health, such as tobacco, and developmental problems in adolescents. So further research is needed to be better understand how drugs may affect pregnant women and developing babies. So mothers and infants affected their prenatal alcohol use. So prenatal alcohol exposure is one of the most important causes of preventable cognitive impairment in the world. So the developing neurological system is increasingly sensitive to harm from alcohol, and there is now also substantial evidence that alcohol-related harm can extend beyond the individual person, leading to epigenetic changes and intergenerational vulnerability and disadvantages. So alcohol exposure increases the risk of congenital problems, including fetal alcohol spectrum disorder or FASD and its most severe form, or fetal alcohol syndrome or FAS. So for many parental smoking, so for many women, smoking is brief escape from the pressure of everyday life. But it's important to remember that smoking is bad for your health. And smoking during pregnancy can harm your unborn baby. So smoking even one cigarette exposes you and your baby to over 4,000 chemicals, and it also means that less oxygen and important nutrients can reach your baby through the placenta. So educational parental cognitive disability without support. So cognitive problems may remain identified. Research rising that has argued that selective cognitive difficulties lead to parenting risk. So IQ may merely be capturing a group with a higher density of specific cognitive problems that more closely link to difficulties in parenting, poor monitoring of children, inconsistent medical care, poor hygiene, and etc. However, these difficulties will be present across the full spectrum of IQ, so difficulties in parenting risk. Low IQ parents exhibit inappropriate expectancies of self-sufficiency from their children, maladaptive schema, poor problem-solving capacities, and more negative appraisals of their children's behavior, as with existing categories of cognitive disabilities, of mental retardation, and learning disabilities. The lack of preparation for parenthood. So prenatal education classes are meant to adequately prepare expectant and new parents during the transition to parenthood. So on elements of the pregnancy itself, labor and childbirth, and general skills of parenting. So first-time expectant and new parents reflect a need for antenatal education to actively include male partners pre- and postnatal. So first-time parents must be aware of the pros and cons of being a parent, prepare emotionally and physically and financially for them to raise their children in a safe and correct manner. And that would include my report. Thank you.
Good morning, everyone. My name is Ara Aldomalag, and I will be discussing the risks and causes of perinatal together with Ms. Eliza Canovas. Perinatal is related to time, usually a few weeks immediately before and after birth. The word perinatal refers to the time before and after the birth of a child. There are risk factors in perinatal, and it's divided into 4 categories: biomedical, social, behavioral, and educational. There are 3 causes of biomedical risk: prematurity, birth injury, and neonatal disorders. Prematurity or premature, also known as preterm birth, is when a baby is born too early before 37 weeks of pregnancy has been completed. The earlier a baby is born, the higher the risk of death or serious disability. Birth injury is defined as an impairment of the neonate's body function or structure due to an adverse event that occurred at birth. Injury may occur during labor, delivery, or after delivery, especially in units who require resuscitation in the delivery room. While neonatal disorders mean disturbance of the normal state of the body, organs, and abnormal function of a newborn. In some cases, the condition is inherited from one or both parents, or the child has an abnormality in his or her chromosomes. Other factors that sometimes contribute are maternal health and toxin exposure, prematurity, labor and delivery complications, genetic disorders, and infections. The second risk factor in the category is social. There's only one cause of mental retardation in the social category. It's the lack of access to prenatal care. The deprivation of prenatal care can lead to premature pregnancy, intrauterine growth retardation, low weight at birth, and maternal and child mortality as a result of infections in the perinatal and postnatal periods. Prenatal care can help keep you and your baby healthy. Babies of mothers who do not get prenatal care are 3 times more likely to have a low birth weight and 5 more times likely to die than those born to mothers who don't get care. And that is all for the causes of the 2 risk factors, biomedical and social. The behavioral and educational factors will be discussed by Ms. Canovas.
Hello everyone, I am Eliza Canubas, and for the other risk factors in perinatal, which is behavioral and educational factor. For behavioral, it includes parental rejection of caretaking. Parental rejection, according to Runner, the absence or the significant withdrawal of warm affection or love from parents toward their children. They found out that parental rejection consistently led to negative behaviors that either externalize the child's distress through bullying or disobedience, or internalize it through anxiety or sadness. Second is parental abandonment of child. A child being knowingly left behind by his or her parent who can be identified and whose intention is not to return but to willingly relinquish parental responsibility. A child who was abandoned by a parent or caregiver may have mood swings or anger later in life. The emotional conflict an abandoned child feels carry into adulthood and include grief, pain, shame, anger, and more. And for the last but not the least, which is educational factor that includes lack of medical referral for intervention services at discharge. Inadequacy in discharge planning, preparation of readiness, and unplanned readmissions are closely linked and could cause the misutilization of hospital services, creating higher costs to the healthcare system. The information given before discharge is vital and great importance for the well-being of the patient. Furthermore, there is a lack of studies concerning the maternal and neonatal referral system in trouble context. And the number of maternal and neonatal mortality death is considered high in the developing countries. Inadequate access to quality of care is one of the factors that can elevate the risk of maternal and neonatal death. Some improvements need to be made to reduce maternal and newborn mortality. One of the improvements can be made by strengthening the referral mechanism and linkages between the various levels of the facilities. And that's all for the risks and causes of perinatal period in intellectual disability, or also known as mental retardation.
Good day, everyone. I'm Shanina of GU1 Apostle Peter from Group 2, and I am here today to talk to you about postnatal. So, what is postnatal? The postnatal period begins after childbirth and it's typically considered to end within 6 weeks as the mother's body, including hormones levels and uterus size, returns to a non-pregnant state. The terms puerperium, puerperial period, or immediate postpartum period are commonly used to refer to the first 6 weeks following childbirth. Postnatal period as the most critical and yet the most neglected phase in the lives of mothers and babies, most maternal and newborns that occurs during this period. So now let's proceed the causes and risk factors of postnatal. First, biomedical factor. Biomedical causes including traumatic brain injury, malnutrition, meningoencephalitis, sensory disorder, and lastly, degenerative disorder. First, traumatic brain injury. Excessive force from the use of forceps or vacuum extractors during delivery can also cause significant physical trauma to a baby's head and brain. Second, malnutrition. There's often a misunderstanding that malnutrition means a child isn't getting enough nutrition. It can certainly be one aspect of the condition. Third, meningoencephalitis. Meningitis is rare in newborn babies, but it can be very serious and needs urgent treatment. Fourth, sensory disorder. They usually involve brief periods of movements in the neck, trunk, or legs, often when a child is waking up or trying to go to sleep. They usually last only a few seconds, but infants may have hundreds of these sensors a day. Lastly, degenerative disorder, a disease in which the functions or structures of the affected tissues or organs changes for the worse over time. Second, social factors. Social causes including impaired child-caregiver interaction, lack of adequate stimulation, family poverty, chronic illness in the family, and lastly, institutionalization. So first, impaired child-caregiver interaction. Older children who receive positive interactions from caregivers also exhibit higher self-esteem, better performance in school, and lower risks of negative outcomes such as depression or drug use later in life. Second, lack of adequate stimulation. This is known to have been recorded in young babies who grow up in orphanage, as well as in preterm babies. One such sensory pathway is touch, which facilitates normal growth and development. Third, family poverty. Poverty can negatively impact families and caregivers in a number of ways, as with children, adults who live in poverty experience worse health outcomes, including higher mortality rates, increased risk of mental health conditions. Fourth, chronic illness in the family. It is worse when each parent or adult caregivers attempt to deal with their own fears and frustration related to the chronic health condition or disability alone and without support. Lastly, institutionalization. In an institution, children may have relationship with staff, however, they may not have one-to-one attachment. Charlene Esperal will keep discussing about the causes and risk factors of postnatal period. That's all, everyone. Have a blessed day ahead.
Good day everyone, I am Charlene Esperar to continue the report of Ms. Shanna Enoch about the postnatal causes of intellectual disability. We have the four types of causes of intellectual disability. We have biomedical, social, behavioral, and educational. The biomedical and social are already discussed of Ms. Shanna Enoch, and now I will be going to discuss behavioral and the educational. So what's in the behavioral? First, child abuse and the neglect. An act or a failure to act which presents an imminent risk of serious harm can result in physical or emotional harm, sexual abuse or exploitations. Second, domestic violence. The term of domestic violence is used where there is a close relationship, example, abusive behavior or a physical abuse, by hitting, slapping, shoving, or etc. that may be considered a physical abuse. Third, inadequate safety measures and actions procedure of contrabands designed to lower the occurrence of risk of injury, loss, and danger to person or property or the environment. Fourth, the social deprivations is the reduction or the prevention of culturally normal interactions between an individual and the rest of the society. What's in the educational? First, Unfairness parenting. Inability of primary caregiver to create, maintain, or regain an environment that promotes the optimal growth with development of the child. Second, delayed diagnosis. Occur when a patient seeks medical treatment for symptoms and yet the condition accusing those symptoms. And third, inadequate early intervention services is the term used to describe the services and supports that are available to babies and young children with development delays and disability and their family.
Good day everyone, I am Franco Compasivo and in this video, let us learn together what is cultural familial retardation. Familial retardation, also called sociocultural or cultural familial retardation, refers to a state of mild mental retardation that is believed to be the result of environmental factors, usually related to some types of psychosocial disadvantages, lack of prenatal care, impoverished circumstances, poor diet, and lack of intellectual stimulation and opportunity, rather than an identifiable physiological or neurological reason. In an American Association on Mental Deficiency, publication on classification Grossman 1983 page 149, individuals suffering from this form of retardation have also been labeled retarded due to psychosocial disadvantage. Familial mental retardation or familial MR is a term which in scientific articles has been applied to families with two or more members affected by MR presumably caused by the same etiological factors, irrespective of being mild or serious, or having narrow or wider familial implications. Now let's talk about the characteristics of cultural familial retarded people. The cultural familiar group includes those individuals whose mental retardation does not result from specific, identifiable organic or genetic anomalies, like Down syndrome or focused brain damage. Excluded from the cultural familiar group are those whose intellectual apparatus has been damaged, thus altering the biological side of the formula. Accordingly, unusual physical characteristics such as those associated with Down syndrome or phenylketonuria are not likely to be present. Instead, cultural familiar retarded persons tend to look very much like those non-retarded peers.
Hello everyone, I'm Yasha Dumagin and today I'm gonna talk about the observations about cultural familial retardation. Familial retardation is usually not detected until a child enters schools and has academic difficulties, at which point the teacher recommends psychological evaluation. Unlike clinically retarded children, parents of those with familial retardation may take offense when their children are labeled mentally retarded, as their children are able to function competently in their daily lives outside school. Critics have pointed out that familial retardation can be diagnosed in children who are unprepared to cope with the demands of school due to cultural and linguistic isolations. One basic observation that has been made many times is that children who have retarded parent and sibling and grow up in a socioeconomically limited environment are more likely to exhibit retarded behavior than are children who have non-retarded parents and siblings and grow up in an average socioeconomic environment. Familial retardation is the most common form of mental retardation, with IQs ranging from 55 to 69 and no signs of physical disability. Environmental causes include quality of prenatal care, maternal and child nutrition, family size, spacing of births within a family, disease and health risk from environmental toxins such as lead. Thank you so much. I hope you learned something.
After discussing the topic, we learned how important awareness is, especially when we talked about health. This topic is a great awareness to every mother or the future one to be able to prevent or take an action to help problems, specifically intellectual disabilities, and improve cognitive development.
I hope you learned something today, and always remember that there are prenatal causes of mental retardation that are unpreventable, but there are also preventable causes. The most common known preventable or environmental cause of MR is fetal alcohol syndrome. So increasing the public's awareness of the adverse effect of alcohol, preventing teenage pregnancy, and promoting early prenatal care would be beneficial to avoid and prevent mental retardation.